Welcome again to the Dr. Ridwan Show, health information you can use. We continue with this show and with this episode on low testosterone, testosterone deficiency, or what we call sometimes low T, or in medical language, hypogonadism. And we are very fortunate today to have with us one of our patients who had low testosterone to help us understand the symptoms of low testosterone and the effects of the treatment of low testosterone. So we have with us today Nick. Nick, we welcome you on the Dr. Ridwan Show.
Thank you, Doctor.
And I want to start by thanking you very much for agreeing to share with our audience and our viewers your story with low testosterone.
My pleasure, Doctor.
So Nick, tell me, you had low testosterone now for how long?
Since probably 04.
Since 2004?
Yes.
And do you remember the time before you had the diagnosis of low testosterone? What symptoms did you have?
Well, where do we begin, Doctor? I had lack of memory. I couldn't remember people's names. Couldn't remember telephone numbers. Had lack of strength. Lack of energy.
Lack of strength and energy?
Yes, I used to work out and I couldn't build any muscle mass. Lack of energy. My sexual function was down. My interest in women was non-existent.
So you had all these symptoms for how long?
Well, I started getting treated with testosterone around December of 05. At that point, I was walking with a cane. I could barely walk more than half a block.
So let me make sure I understand this. You were walking with a cane because you had no strength?
I was diagnosed with MS and I had no strength because of that. And once I got testosterone, everything started to kick in.
So in addition to the low testosterone, you had a diagnosis also of MS, which is multiple sclerosis.
Yes, doctor.
Okay. So when you had the diagnosis of testosterone deficiency or low testosterone, did you receive treatment?
Yes, I did.
And what form was that treatment?
It was in a gel, testosterone gel.
It was a testosterone gel, so it is a gel that you apply every day?
Yes.
And tell us about the effects of the treatment with the testosterone gel.
Within 1 month's time, my memory started coming back. That was the first thing I noticed. And gradually in time, my strength started coming back. I started getting an interest in women again, sexual functions coming back somewhat. It was like night and day, complete night and day.
And you continue since 2005 to receive the testosterone treatment?
Yes, I take the gel every day. I apply it on my shoulders and I apply it on my stomach.
Have you had any side effects?
Only side effects maybe is problem sleeping.
But sometimes you have problems sleeping.
Problem sleeping, yes.
But other than that, you've been happy and satisfied?
Very happy, yeah.
Very good. Well, once again, we thank you for sharing with us your story with low testosterone, explaining the symptoms of difficulty concentrating, low strength, low energy, and sexual dysfunction, and the effects of testosterone treatment in reversing these symptoms and giving you the ability to concentrate, the energy, the muscle power, and also the satisfactory sexual function. Once again, thank you, and we welcome you to the Dr. Ridwan Show.
My pleasure, Doctor.